A next question is somewhat related. Any input on whether children under 5 will be approved to get vaccines soon?
So the studies of vaccines in young children have been slowed by difficulty finding the most effective dose and dosing scheme. The first round of dosing did not induce the kind of immune responses that people were hopeful for. And so as a result, the studies were slowed. I do think we'll see favorable results in the under 5 population sometime in this calendar year, which I know just started, so it doesn't sound so great, but I do think that we'll get there. One of the silver linings of having lots of cases is that you get to have a faster signal on your vaccine efficacy studies.
Next question. Thoughts about the value of a 4th booster for age 60 plus? I know there was a study that was released from Israel today.
Yeah.
Or yesterday.
It's very, right now, when you look at that study, you go, there's no point in giving a 4th dose. But they gave it within 4 months of their 3rd dose. So in some ways, it's not surprising it didn't show any benefit, right? Because people who get boosted, their antibody levels are already very high. And that 4th dose, I don't know that it would do anything. However, a 4th dose a year from dose number 3, or a 4th dose at some point in the future is plausible. And what the hope is that they are able to find a conserved antigen in the virus that doesn't need constant tweaking, so that we don't be in the situation of continuing to see variants that break through our immune defenses. So that's the hope, that there's a coronavirus, SARS-CoV-2 antigen that's conserved, that it will not change with future variants sufficiently in order to make protection more durable.
Next question. Is an Omicron vaccine going to be available? And if so, is it needed? And if it's needed, when might you anticipate it would be available?
So the issue is those epidemiologic curves that I showed you, where it comes into a community and takes off, and then it leaves almost as fast as it arrived. You know, do we actually need an Omicron variant vaccine? I think one could make the argument that we don't. It would have been nice to have it 3 weeks ago, but that isn't like something you can just do. So, it takes, even though mRNA vaccines are quite adaptable, they're not going to be adaptable like that. I mean, with each variant that comes in, there's been discussion, should the pharmaceutical companies make a variant-specific vaccine? And, the vaccines, they're still, a fully boosted immunocompetent person is over 90% reduced risk of even hospitalization and 99% reduced risk of dying. That's amazing. So they're still doing something.
Yes, it's a strong reason to be vaccinated twice and boosted.
Yes.
What's your perspective on long COVID and other long-term effects of this infection?
It's quite real. I think I've seen really two forms of it. One are people who have really terrible objective changes to their bodies, their brains, their lungs, their vital signs. They're tachycardic all the time. They're short of breath with minimal exertion. They've clearly been damaged and scarred by their COVID. Another group has nothing that I can find like that, but they're just not the same. Their brain isn't the same. They tell you they're tired all the time. They have brain fog. They have a lot of the same conditions that people who had severe Lyme disease get in New England, where they have a lot of non-specific brain fog that never goes away even after Lyme has been treated and eradicated. So I think those are the two big groups. There's some overlap, of course. that first group is I actually see that I see them and then refer them to pulmonologists and cardiologists because there's definitely some residual scarring from their individual infection. The second group, I think, a neurobehavioral assessment because they cannot seem to concentrate. They can't focus on things as well. They are tired with minimal mental effort and physical effort. It's very much reminiscent of a lot of the post-infectious fatigue syndromes that ID doctors have seen for their whole career, like me.